Hello and welcome to our latest in the series of podcasts exploring the content and opportunities in the NHS Cancer Plan. Today I'm talking to Laura Bengree, Lead Nurse for Paediatric Oncology at the University Hospital Southampton. That's our principal treatment centre for children's cancer across the whole of Wessex.
Hi Sally, thank you for inviting me to chat to you today about the National Cancer Plan.
Hi Laura. Can you explain the ambitions that have been set out in the plan for children and young people's cancer?
Okay, so one of the most significant developments in the 2026 National Cancer Plan is that for the first time ever, children and young people have got a dedicated chapter within the national strategy. And I think that that's hugely important because it does recognise that children, teenagers and young adults with cancer have very different needs to the adult population. The ambitions for children and young people's cancer within the plan is around the earlier and faster diagnosis of cancer. So acknowledging that there are still huge delays in when we see children at the point of diagnosis. And, that is becoming increasingly more complex with some of the rarer cancers that we see, such as those with brain tumours or more complex solid tumours. And so with the strong kind of emphasis and focus around ensuring that, there are things that are put together to promote earlier diagnosis and raise more awareness, I think that that's going to be something that's hugely advantageous with this strategy. And hopefully, it will support kind of our primary care practitioners to arrange kind of diagnostics and ensure that there's more access to specialist services. So one of the other ambitions is around improving the care experience for children and young people and the whole family. So in children's cancer, we treat the family in its entirety, which includes siblings, their grandparents, aunties, uncles, mums, dads, and the level of care that they need is not just medical, it's often psychosocial with emotional, psychological, financial and practical support. And that we feel in children's cancer and for those young people as well is almost as important as giving the cancer treatment itself. And the commitment for the government to provide funding for transport to access treatment is absolutely pivotal and I think has been so important. And I know we're going to cover it later on, but probably one of the most valuable things, having spoken with families on a day-to-day basis, that will make such a significant difference to them. They also plan acknowledges the emphasis on equitable access within the genomics testing. And so we can be more precise with the medicines that we're giving and provide more access to clinical trials. And this is particularly important for cancers that are rarer or more difficult to diagnose. And I think, it will also give our families reassurance if there's a predisposition to cancer that the follow-up and the screening and monitoring throughout their lifetime will be something that can continue much longer after their cancer treatment has been completed. The fourth ambition in the plan is around research and long-term outcomes. And what we do know in children's and young people's cancer is that our treatments are improving and we are getting better outcomes for them. And not only are we treating patients now with first or second line treatments, but we're actually able to offer more lines of treatments and in some cases up to fifth or sixth lines of treatment. What we do know though is that within that our research also needs to focus on survivorship and late effects, looking at quality of life, because although we might achieve a survival, we want to ensure that that survival comes with quality of life that means that young people can live for decades after their treatment well and with an appropriate structured long-term follow-up. And I think the fifth ambition, which is really important, is about reducing inequalities and variations within the UK. And certainly we would like to see the end of kind of postcode lottery, which probably is something that we don't necessarily always see in children and young people's cancer, but is something that has occurred previously in the past. But I think acknowledging that will ensure that it's something that is continued to improve, and access to specialist care, research and supportive services, regardless of where children and young people live within the UK, will be equitable throughout. So they're the kind of 5 ambitions that I think will help to improve not only the treatment that's being delivered, but also the experience and the long-term future for children, young people and their families who are affected by a cancer diagnosis.
What does this mean for Wessex? And what will we need to do more of or differently to achieve those ambitions?
So, I mean, for Wessex, continuing to strengthen our role across the region for children and young people is obviously going to continue being really important. I mean, we already have excellent foundations with the Cancer Alliance in Wessex and our operational delivery networks, and actually more widely with our national Children's Cancer and Leukemia Group, who support a lot of our guidance and teaching and education. We are in Southampton only one of 21 PTCs, so principal treatment centres across the UK. And so it is really important that obviously we are using the ambitions set out in the cancer plan to support our patients who live within our region, but also to support our colleagues nationally to reduce health inequalities as well. So within Wessex, we are kind of slightly ahead of the game in some of these, having preempted what we were likely to see within the National Cancer Plan. And one of the areas that I think we've developed quite some robust tools is about helping to improve earlier diagnostic pathways. And we have had a working group with the Cancer Alliance looking at the development of the 2-week wait programme that initially was focused predominantly on adults. So now we have an urgent suspected cancer pathway for under 16s, and actually utilise the national guidance that has been written both by NICE and also the CCLG in helping to develop signs for primary care practitioners in particular to recognise when symptoms suggest that there may be a cancer diagnosis. So the tool that we have created is not only a referral pathway, but is also a teaching and education document. And also one of the things that's been really important is we've worked with our GPs to design this suspected cancer pathway, and it's helped develop our stronger collaboration with our primary care and urgent care practitioners, and that is absolutely pivotal in supporting those practitioners to see and diagnose cancers earlier on. And we hope that work will continue moving forward. So the other thing is about strengthening our psychosocial and our holistic care, and the National Cancer Plan does move beyond kind of clinical outcomes. It is looking more around kind of the investment in psychology in children and young people, around youth and play, education support and survivors. And I think families do need that kind of emotional and practical support alongside treatment to get the very best care. And we hope to make more links with our charity partners to improve the access to psychological and holistic care.
What were you most pleased to see in the cancer plan that will really improve children and young people's experience of cancer when it's been achieved?
One of the things in Wessex is we're both a rural and an urban population, and travel for our families is hugely burdensome. And I think, like I said earlier, I think one of the things that's going to make some of the biggest impact to our patients is going to be the support of travel. One of the other things that we're looking at developing, and we've just received some funding for, is the development of our ambulatory service. And that is going to be about making sure that patients can receive their care at home or as close to home as possible. And so there's going to be lots of work done with our shared care hospitals, of which we have 12 in Wessex, to ensure that if chemotherapy can be given at their local hospital or at home, that we will aim to achieve that. So again, that's something that we're kind of already working on in Wessex, and now supported by the kind of national plan as well, which is brilliant. But ultimately, the main kind of thing that I think we're very good at in Wessex is about working collaboratively as a system and ensuring that, as organisations, we're working together, both with the Cancer Alliance, with the Operational Delivery Network, with NHS England, with our POSCUs, because we all know that when we work in isolation, we don't get as much achieved as if we're working together as a partnership. And, for us in children's cancer, that doesn't just necessarily include, our NHS organisations, but us in children's cancer, our charities, our schools, our community teams, and the family themselves, and the children and young people are absolutely pivotal in that. And I think, one of the things that I was really pleased to see is the promotion of that continuing.
Are you excited to see where we will be in 10 years' time?
Yeah, no, absolutely. I mean, I think, the most important aspect is that I was really pleased to see that there is very clear recognition of children and young people in the National Cancer Plan. And that's fundamentally a different approach to cancer care previously, and will make a huge difference. And, also I think, the focus nationally previously has always been around kind of survival and waiting times. And I think what's really nice about this plan is it gives equal weight to experience, to well-being, to life beyond treatment. And that's a major cultural shift within, the UK. Ultimately, when the plan is fully realised and successful, it will mean that children and young people are not only able to survive cancer, but will feel supported, understood, and live well well afterwards, both from an educational point of view, emotional, social, and physically. And that's really exciting, that the ambition of the National Cancer Plan feels real. And I'm really excited to see where we are in 10 years, to see whether actually we've got that balance right between ensuring equality of access, ensuring, psychological, emotional, and physical well-being, as well as improving treatment modalities and delivery, and hopefully also ensuring that care that can be delivered as close to home is achieved, because I think that that's vitally important for children and young people, so they can continue accessing school and living at home and waking up in their own bed.
Thank you so much, Laura, for taking the time to talk to me today about the opportunities that you see that we have to take forward and improve children and young people's cancer in the future. Join me in our next podcast, when I will be talking to Anne Crowdass about the opportunities for research and clinical trials in cancer care. Thank you for listening.